Good day, ma'am. I am Surab Buisan, 3BSNA, and I'll be performing the insertion of nasogastric tube. So first is to verify the medical order for insertion of an NG tube to ensure that the patient receives the correct treatment. Perform hand hygiene and put on PPE if indicated. PPE is required based on transmission precautions while hand hygiene prevents the spread of microorganisms. So assuming that I already done those. Next is to identify the patient. This ensures that the right patient receives the intervention and helps prevent errors. So, good afternoon, ma'am. I am Surab Buisan. May I know your name po?
Arian Merin.
Miss Arian Mirin. Thank you po. Explain the procedure to the patient and explain why the tube is needed. Discuss the associated discomforts that may experience and possible interventions that may allay this discomfort. Answer any questions as needed. Next is to explanation facilitates patient cooperation. The insertion of an NG tube is considered the most painful. A lidocaine gel or spray is a possible option to decrease discomfort during NG tube insertion. So ma'am, may order po si Doc na mag-insert po ng NG tube. Uncomfortable po siya ma'am, pero need po siya ma'am sa condition niyo po ngayon. Makakatulong po siya ma'am sa para po mapadali yung food intake at pag-administer po ng medications po. So, mag-operate lang po tayo mamaya ma'am. Thank you po. Next is to gather equipment and select the appropriate NG tube to provide an organized approach to task. NG tube should be radio-opaque, contain clearly visible, marking for measurement, and may have multiple ports for aspiration. So, next is to close the patient's bedside, curtain or door to provide privacy. Raise the bed to a comfortable working position. Assist the patient to high Fowler's position or elevate the head of the bed 45 degrees if the patient is unable to maintain an upright position. So, ma'am, position lang po tayo. The upright position is more natural for swallowing and protects against the bronchial intubation, aspiration if the patient should vomit. Drape the chest with bath towel or disposable pad. Have emesis, basin, and tissues handy because passage of tube may stimulate gagging and tearing of ice. So, ma'am, maglalagay lang po tayo ng towel. Then after that, put on gloves. Next is measure the distance to insert the tube by placing tip of the tube at patient's nostril and extending to tip of earlobe and then to tip of xiphoid process. Then mark tube with an endable marker. This ensures that the tube will be long enough to enter the patient's stomach. Nostril. Then mark. Then lubricate at least 2 to 4 inches of tube tip with water-soluble lubricant. Lubrication reduces friction and facilitates passage of the tube into the stomach. Um, Water-soluble lubricant will not cause pneumonia if the tube accidentally enters the lungs. Then apply the topical anesthetic to nostril and oropharynx as appropriate. It acts as local anesthetics, reducing discomfort. Then consult the primary care provider for an order for a topical anesthetic such as lidocaine gel or spray if needed. Then after selecting the appropriate nostril, ask the patient to slightly flex head back against the pillow. Gently insert the tube into the nostril while directing the tube upward and backward along the floor of the nose. The patient may gag when the tube reaches pharynx. Provide tissues for tearing or watering of eyes, and then offer comfort and reassurance to the patient. So, ma'am, tissue po. Flex lang po natin yung head natin. Then, following the normal contour of the nasal passage while inserting the tube reduces irritation and the likelihood of the mucosal injury. The tube stimulates the gag reflex readily. Tears are natural response as the tube passes into the nasopharynx. Now, when the pharynx is reached, instruct the patient to touch chin to chest, bringing the head forward and helps close the trachea and open the esophagus. Then encourage patient to swallow even if no fluids are permitted. So, ma'am. So, ma'am. Lunok po. 1, 2, 3, lunok. 1, 2, 3, lunok. 3, lunok. Then advance tube in downward and backward direction when patient swallows. Stop when patient breathes. Swallowing helps advance the tube and causes the epiglottis to cover the opening of the trachea and helps to eliminate gagging and coughing. Next is if gagging and coughing persist, stop advancing the tube and chest placement of tube with tongue, blade, and flashlight. If tube is curled, straighten it and attempt to advance it again. Excessive coughing and gagging may occur if the tube has curl in the back of the throat. Keep advancing the tube until pen marking is reached. Do not use force. Rotate tube if it meets resistance. Forcing the tube may injure mucous membranes. Then discontinue procedure and remove the tube if there are signs of distress such as gasping, coughing, cyanosis, and inability to speak or hum. The tube is in the airway if the patient shows signs of distress and cannot speak or hum. If after 3 attempts, nasogastric insertion is unsuccessful, another nurse may try to the patient should be referred to another healthcare professional. Then secure the tube loosely to the patient nose or cheek until it is determined that the tube is in the patient's stomach. Securing with the tape stabilizes the tape while position is being determined. Then attach syringe to end of the tube and aspirate a small amount of stomach contents The tube is in the stomach if its contents can be aspirated, pH of aspirate can and then be tested to determine the gastric placement. So this is the syringe. Measure the pH and aspirate the fluid using pH paper or a meter. Then place a drop of gastric secretions on the pH paper or place small amount in plastic cup and dip the pH paper into it. Within 30 seconds, compare the color on the paper with the chart supplied by the manufacturer. Attach a septic syringe to NG tube. Then discontinue procedure and remove the tube if there's any signs of distress such as gasping, coughing, cyanosis, and inability to speak or hum. The tube is in the airway if the patient shows signs of distress and cannot speak or hum. Next is to visualize aspirated contents, checking for color and consistency. Gastric fluid can be green with particles, off-white or brown if all blood is present. Intestinal aspirate tends to look clear or straw colored to a deep golden yellow color. Obtain a radiograph or the X-ray of placement tube based on the facility and ordered by physician. The X-ray is considered the most reliable method for identifying the position of the NG tube. Remove gloves. Then remove gloves and secure tube with a commercially prepared device or tape to patient's nose. To secure with tape, skin barrier improves adhesion and protects skin constant pressure of the tube against the skin, and the mucous membrane may cause tissue injury. So, remove gloves. Then cut a 4-inch piece of the tape and split the bottom 2 inches or use package nose tape for NG tubes. Then place and split over the bridge of patient nose. Wrap split ends under the tubing and up and over onto nose. Be careful not to pull the tube tightly against nose. Then put on gloves, clamp tube and remove the syringe. Cap the tube or attach tube to suction according to the medication orders. Suction provides for decompression of stomach and drainage of gastric contents. So put on gloves. Then measure the length of exposed tube. Reinforce making on tube at nostril with edible ink. Ask the patient to turn to the head to or ask the patient to turn head to the side opposite the nostril in which the tube is inserted. So ma'am, yung sa kabila. Secure tube to patient's gown by using rubber band or tape and safely pin. For additional support, tube can be taped on the patient's cheek using a piece of tape. Next is assist with or provide oral hygiene at 2 to 4 hour intervals. Lubricate the lips generously and clean nares and lubricate as needed. Offer analgesic throat lozenges or anesthetic spray for throat irritation if needed. Oral hygiene keeps mouth clean and moist, promotes comfort, and reduces thirst. Then remove equipment and return patient to a position of comfort. Then remove gloves, raise side rail, and lower the bed. Then lower the side rail. Then remove gloves. Then this procedure promotes patient comfort and safety. Removing gloves properly reduces the risk for infection, transmission, and contamination of the other items. So next is to remove the additional PPE if used and perform hand hygiene, because removing PPE properly reduces the risk for infection, transmission, and contamination of other items. Hand hygiene also prevents the transmission of microorganisms. And now, I'll be performing the removal of the nasogastric tube. So first is to verify the order of the doctor to discontinue the nasogastric tube. Then explain a procedure to the client. So, good morning po, ma'am. I am Surab, your nurse for today po. So, may order po si Doc na tanggalin na po yung NG tube niyo po. Mag-operate lang po tayo, ma'am. Thank you po. Next is to assemble all equipments at bedside. So, here the equipments. Hand hygiene, I assuming that I already done that. Stand on client's right side if right-handed and left side if left-handed. So I am right-handed, so I'm standing with the right. Next, position client in high Fowler's position unless contraindicated. This reduces risk of pulmonary aspiration in the event client vomits. So ma'am, position lang po tayo. Okay lang po, ma'am. Komportable po kayo. Then, don clean gloves. This is to prevent the transmission of microorganisms. Next is to place a disposable pad or towel over client's chest, prevent mucus and gastric secretions from soiling client's gown. Next is to turn off suction and disconnect NG tube from drainage bag or suction. Remove the tape from bridge of nose and unpin tube from gown. Detach the tube, and this is to free tube from connection before removal. Then ask the client to take a deep breath to prevent inadvertent aspiration of gastric contents while tube is removed. Clamp or kink tube tubing securely by folding it over on itself. Then completely withdraw the tube by pulling it out steadily and smoothly. So ma'am, hinga lang po tayo ng malalim. 1, 2, 3. Hinga po. Then dispose in a proper receptacle to prevent residual leaking of fluid in tube and minimizes client discomfort and prevents transmission of microorganisms. Then offer tissues to client to blow nose, provide oral hygiene, and to clean nasal passages of remaining secretions and promotes client comfort. Tissue po. Then remove gloves and perform hand hygiene, for it reduces transmission of microorganisms. Then after that, document all relevant data, record the removal of the tube, the amount and appearance of any drainage if connected to suction, and any relevant assessments of the client. And that's all for the removal of the nasogastric tube.